As Uganda and other African countries grapple with rising rates of teenage pregnancy, HIV infections, and gender-based violence among young people, experts are reviewing whether existing laws adequately address the needs of adolescents. Health professionals, policymakers, cultural and religious leaders have convened in Kampala to examine the proposed sexual and reproductive health model law framework and its potential to improve access to age-appropriate health services while safeguarding family and community values.
The Constitution of Uganda recognizes an adult as a person aged 18 years and above. Yet, the realities on the ground paint a different picture, with many adolescents becoming sexually active years before reaching adulthood.
The point and the question today for all of us is, what is the root cause of this problem?
Uganda has made significant progress in expanding sexual and reproductive health services through various policies and national guidelines. However, challenges remain, particularly regarding consent and the age at which adolescents should independently access these services.
Parents who are there are also adolescent parents, so at the end of it, they are not able to provide the relevant information for the upbringing, coupled up with the social media.
This growing disconnect has contributed to increasing cases of teenage pregnancies, HIV infections, and gender-based violence, prompting fresh debate on whether existing legal and policy frameworks adequately protect young people.
The laws of the country restrict access to health care, including sexual and reproductive health services, to adolescents or young people who are above the age of 18, which means that those who are below the age of 18, when they present at local health facilities, they are turned away or they are offered services at the discretion of the healthcare provider.
These concerns formed the centerpiece of the values clarification for attitude transformation for follow-on meeting.
Evidence is showing us that when access is availed, young people can be able to make an informed decisions. And for Uganda, we are working together with government, civil society, young people, religious and traditional leaders to ensure that all adolescents can access sexual and reproductive health services in the context of universal health care access.
Delegates from Uganda, Kenya, Malawi, and Zimbabwe joined health, gender, and policy experts in examining solutions to what has become known as Africa's triple threat burden: teenage pregnancies, HIV/AIDS, and gender-based violence.
Many clans are now fighting the cultural misbehaviors in the villages by giving them punishments culturally.
Religious leaders emphasized that while faith remains rooted in biblical teachings, empowering communities with accurate information and knowledge is equally essential.
Let us package it well, because the issues of family planning in this country have created hot debates, as you have been hearing. But the only issue that is bringing all that is having the right information to the right people.
Recommendations emerging from the Kampala meeting will be submitted to regional platforms, including the Southern African Development Community, SADC, and the East African Legislative Assembly, to inform discussions on adopting a harmonized sexual and reproductive health model law framework across Africa.
After the ratification or the adoption of the model law, we'll be working with the government of Uganda so that the local laws or the national laws are aligned with the model law guidelines.
These are national guidelines on health, education, and life skills for out-of-school adolescents and youth. Now, it is an overarching document for SRH, sexuality education, health education, life skills, and it is so that whoever wants to develop any materials, we will or they will anchor themselves on that overarching document, and that is where we anchored these guidelines.
The hope is that future legal reforms will strike a balance between protecting children, preserving societal values, and ensuring that no young person is denied access to essential sexual and reproductive health services because of age alone. Chris Biondo, UBC.